All right, let's now get you all the details of the COVID-19 infection surge in the country. India once again has reported over 3,000 cases. The positivity rate on a daily basis is inching close to 3%. Well, the increase in cases is actually the highest daily infections this year. Maharashtra has been recording the highest number of cases along with Kerala. Delhi Chief Minister, in fact, on Friday, held a high-level meeting. The state has advised use of masks by people with respiratory diseases. Medical experts are also advising caution. I filed this report earlier. Take a look.
Doubling in 7 days, 3,000 cases for 2 days in a row. Positivity rate touching 3% mark. Indications are that 3 years after it brought the world to its knees, COVID-19 cases are to grip India once again. The culprit here, XXB.1.16a, subtype of Omicron, is the one causing the surge in cases. This subvariant rapidly transmits and has additional mutations.
Special attention needs to be paid to stop transmission within hospitals. For instance, when people with fever come to hospital, they should not be spreading the virus to other vulnerable individuals. Therefore, triaging and wearing of masks, especially within hospitals, will be helpful.
What then are the symptoms and who's vulnerable?
This time with COVID-19, we are seeing symptoms with high-grade fever, body ache, some running nose and cough. However, these symptoms can be severe in age groups more than 60 years of age or patients suffering with comorbidities like diabetes, blood pressure, heart diseases or chronic lung diseases.
The problem is that this is the hybrid lineage of recombinant XXB of the Omicron family, the fifth variant of concern that continues to be the one which is most infectious by far. Ever since it was first detected in Botswana and South Africa in November 2021, it continues to circulate globally pretty much unchallenged.
India has seen over 40% jump in daily COVID-19 cases, highest in 6 months. The central and the state governments say they are not seeing a surge in hospitalizations.
बहुत कम अभी केसेस हैं और कोई सीवियरिटी भी नहीं है, लेकिन तैयारियों को देखते हुए हमारी 60,986 बेड्स हमारे अभी तैयार हैं कोरोना के लिए. इसमें ऑक्सीजन वाले बेड्स भी हैं, इसमें वेंटिलेटर बेड्स भी हैं, इसमें आईसीयू भी हैं. 7,986 बेड्स हैं जिसमें से 66 बेड्स केवल ऑक्यूपाइड हैं. आरटीपीसीआर के टेस्ट करने की हमारे पास सफिशिएंट क्षमता है.
Doctors continue to advise going back to basics.
The good news, however, is that most of these COVID cases are just mild illness, behaving like common cold and flu. But it is important that we do test in these patients so that we get a right diagnosis and can then accordingly isolate them. Most of these cases require just symptomatic care, rest at home, isolation, and good hydration. We must remember that the precautions, that is wearing face mask if one has symptoms. The caretakers or people around also need to wear mask. We need to avoid overcrowding and we need to maintain social distance, wash hand and follow the cough or sneezing etiquettes.
What about vaccinations and how far will they protect the population?
With the upcoming of the mutant variants, there can be a decrease in the effectiveness of the existing vaccination. Having said that, multiple studies has been done in the population which clearly suggests that the currently available vaccines, which are the Covaxin and the Covishield, will help in protecting the population against severe forms of the COVID-19 infection. The government clearly instructs us to take at least 2 doses of the COVID-19 vaccination along with 1 precautionary dose of the COVID-19 to protect us against the severe forms of the COVID-19 despite having the mutant strains circulating in the population.
With Sneha Modani, Bureau Report, India Today.